Good morning, good afternoon, good evening, depending on your time zone. I'm Dr. Heather Stanley. I'm your pregnancy specialist, and I'm here to talk to you today about polycystic ovarian syndrome and planning for pregnancy. Specifically, I'd like first to talk about the plan before the plan. So, for those who, just a quick refresher course, PCOS typically involves either irregular or absent menstrual cycles that may cause anovulation or the inability to ovulate. When the lack of ovulation occurs, or menses may be delayed. So menstruation is really just nature's way of signaling us that we're not pregnant. And so if we don't have that on a regular basis, then things are just up in the air for A, fertility, and B, for questioning pregnancy. Now with PCOS, the other thing that tends to happen is that androgen hormones tend to be elevated, and because of insulin resistance, the body will actually produce more insulin in an effort to overcome the insulin resistance. And please apologize, there's construction where I am, so that's out of my control. So those are the issues with PCOS. So I'm just going to offer you 3 quick tips. The first thing we really need to do is we really need to assess and track your cycles and an ovulation. If you do know that you have a problem with figuring out when your periods are going to come because they're more than 32 to 35 days, sometimes it may be as severe as twice a year, but you've always, at least for 12 months prior to today, recognized that that was a problem, then it's time for you to seek a professional health doctor, preferably a gynecologist. If you're under the age of 35, so if you're in your 20s and not, or just about to approach 30, that would be the best time to go to a gynecologist, because we can quickly assess the need for us to do some basic things, and then refer you to a higher level of service if you are needed. Now, if you're at your 33 years and above, please don't delay. Find a gynecologist specifically for a referral to a reproductive endocrinologist and infertility specialist. These are OBGYN certified subspecialists who have done fellowships in endocrinology and infertility. Any other specialty that's not credentialed by the American Board of OBGYN, please stop, press pause, ask questions. But we're talking about board certified reproductive endocrinology and infertility specialists. Those specialists will help you to figure out what is the best way to get pregnant before your ovarian reserves are diminished. Okay? So that's the first thing. The other thing is, if there is or even while you're in the throes of evaluation with your gynecologist and your RE&I board certified specialist, there are still some modifications that one can do as we are planning the plan to get pregnant. If weight, obesity is an issue for you, even a reduction of your weight by 10% can improve your chances of getting pregnant. Seeking help, nutrition modification, by whatever means, We have to be careful with the medication-induced weight loss, because those typically, if you're losing weight on weight loss medications, you need to continue them long term. And so getting pregnant on these medications at this time is not advised. So we're looking for non-pharmacologic food wisdom way of trying to get your weight down 10% or less, or more, sorry. Stress management, that is a big thing. So assessing your need for assistance with stress management, there's no shame in seeking out help for that. But chronic stress is known to change cortisol and other hormonal levels that can impact our overall general health and impact, our ability to try and get pregnant. So we should not ignore that. Last but not least, patience and persistence. Moving out of the mindset of I want what I want when I want it, and I wanted it 10 minutes ago, is really not the best plan in this case, and actually is applicable to so many other cases too, but I digress. Being patient, being persistent, being consistent will get you to your goal. We have to bear in mind that PCOS or no PCOS, there's only 36 hours in a month where that time is optimal to get pregnant. And so the timing of the menstruation cycle is key, because we have to figure out when is the best time that that egg is going to ovulate in that 36-hour period for which intercourse must happen for pregnancy to occur. All right. So again, this is Dr. Heather Stanley Christian coming to you, wishing you a wonderful Wednesday. Want you all to breathe. Want you all to walk good. And if you have any curiosity, I do encourage you to check us out at Unity MFM. Please, at a very minimum, we're happy to answer any questions. We're happy to do any consultations. We're happy to even help you find the best fit next step. So we do offer some serious individualized care and assistance in it with those respects. So, peace.